Pregnancy is a time of anticipation and wonder. If you are taking a prenatal vitamin, you may want to check if it contains DHA or docosahexaenoic acid, which is an omega-3 fatty acid, and make sure it is doctor recommended DHA. Docosahexaenoic acid is an omega-3 polyunsaturated fatty acid, which is an essential nutrient not only for you but also for your baby, which should be in good amounts in your body if you want to have a healthy pregnancy that will deliver a healthy, intelligent baby at the right time. Before getting into how it helps in pregnancy, let's find out what is the function of DHA in the human body. DHA is located mainly in cell membranes where it forms a membrane. These membranes separate cells from extracellular fluids, forming gaps. This helps to transmit messages between nerves through electrical signals. When it comes to the brain is the fatty organ, and between 10% and 20% of its total fats are DHA. DHA is the most abundant omega-3, which is about 90% of polyunsaturated fatty acids in the brain and is concentrated in gray matter. DHA helps increase blood flow during mental tasks. Delivering a baby before 34 weeks is considered an early preterm birth and increases the baby's risk of health problems. Some recent observational studies have shown that there may be a correlation between preterm birth, preeclampsia, and hypertension in pregnancy with the DHA. DHA concentrations in umbilical plasma phospholipids decide the duration of babies in the womb. Baby brain development continues throughout the pregnancy. Especially during the last trimester, brain and eye development becomes rapid. If the baby is delivered prematurely, it will lack DHA accumulation in the brain, which occurs in the last trimester. DHA has anti-inflammatory properties that help keep you and your baby safe from infections and complications. Maintaining a balanced intake of DHA can also boost your mental health, reducing the risk of postpartum depression. And let's not forget about your heart. DHA supports your cardiovascular health during this time of great change. So how DHA play a role in infant health? DHA is extremely important for brain tissue growth and function, especially during development and infancy. It needs to accumulate in the central nervous system for your eyes and brain to develop normally. The frontal lobes are particularly dependent on it during development. These parts of the brain are responsible for processing information, memories, and emotions. They are also important for sustained attention, planning, problem solving, and social, emotional, and behavioral development. The fetal brain begins to develop in the first trimester around 5th week, but it's an ongoing process throughout the pregnancy. Accumulation of DHA in the fetal brain occurs continuously throughout the gestation but is most active during week 29 to 40. If you found this video informative so far, don't forget to like, share and subscribe to my channel. Your one like will help me boost my channel. So what happens if pregnant woman does not get DHA through diet? The placenta is a structure that connects the baby and mother with the umbilical cord. Any structural or functional impairment can lead to poor pregnancy outcomes such as risk of preeclampsia and intrauterine growth restriction, preterm births, etc. Some recent studies have shown it is also involved in the first trimester's placentation process, and placental size depends on the DHA levels in the first trimester. Low concentration of DHA in the umbilical plasma phospholipids can cause preterm births. The pregnant woman supplemented with 600 mg DHA per day before 20 weeks of gestation until delivery significantly reduced the preterm delivery and low birth weight babies. Decreased DHA in a developing brain leads to a reduced amount of new nerve cells and altered nerve function. It also impairs learning and eyesight. Furthermore, low levels in mothers are linked to an increased risk of poor visual and neural development in the child. Studies have shown that babies of mothers who consume 200 mg per day of DHA from the 24th week of pregnancy until delivery had improvements in vision and problem solving. Hence, DHA is important in the third trimester of the pregnancy. So how can you get DHA? Prenatal vitamins containing DHA are a great way to get it, but you can get it through the diet. Some seafood and fatty fish such as oysters, salmon, herring, lobsters, etc. contain DHA. You just have to be careful that you are not consuming fish with the high mercury levels. According to the American College of Obstetricians and Gynecologists, limiting seafood to 8 to 12 ounces per week can reduce exposure to methyl mercury. Fortified foods such as dairy and eggs can also be the good sources of DHA. If you are vegetarian or vegan, don't forget to check out the 8 plant-based DHA sources video. The link to the video will be mentioned in the description box below. Thank you for watching.